Alright, team. This patient presents with symptoms of osteochondritis, eosinophilic fasciitis, and endometritis. What do you think could be the diagnosis?
Osteochondritis and eosinophilic fasciitis point towards an autoinflammatory condition, but endometritis is throwing me off. Could it be related to the reproductive system?
I agree with Gary. It seems like a mix of musculoskeletal and inflammatory symptoms. Maybe it's an autoimmune disease affecting multiple systems.
I think we should consider a rare condition like epispadias. It could explain the diverse symptoms we are seeing.
I knew you were the smart one, Frank. It is indeed epispadias. And the treatment we need to perform is hypophysectomy. I know it's risky, but it's our only option to save this patient's life.
Are you sure about this, Hawks? Hypophysectomy carries a high risk of complications.
I don't give a damn about the risks. This is our patient's best chance. Now scrub in, all of you. We have a surgery to perform. Tracy, I need to talk to you about something important. I want to perform a hypophysectomy on my patient who I believe has epispadias.
Hawks, are you sure about this? Have you confirmed the diagnosis? This is a serious procedure.
Of course I'm sure. I have years of experience in this field. You can't just question my judgment like this.
I understand your expertise, Hawks, but we need to be certain before proceeding with such a risky operation.
Risky or not, I know what I'm doing. I have successfully carried out similar surgeries before.
I trust your abilities, Hawks, but we can't afford to make a mistake here. Let's review the case together and make a well-informed decision.
Fine, but don't doubt me, Tracy. I have the best interest of my patient at heart.
Oh no, this isn't good. The patient is in critical condition after the hypophysectomy.
I need to think about how to break this news to Hawks.
How am I going to explain this to Hebstan?
What the hell were you thinking? You nearly killed a patient with your incompetence.
We followed the standard procedure for hypophysectomy. It should have worked.
Maybe we misdiagnosed the condition. That's why the treatment didn't work.
I'm not so sure about that. I still think it was the right diagnosis.
You bunch of fools. You couldn't diagnose a cold correctly. You better figure this out before I have to clean up your mess again.
We'll review the case again. We will find out what went wrong.
We can't afford to make these mistakes. We need to be more thorough next time.
I'll double check everything. We won't mess this up again.
You better not. I'm holding you all responsible for this disaster. I'm out of here. Don't screw this up any further. I can't believe I haven't figured out what's wrong with Mr. Smith yet.
Maybe you should try checking his blood work again, or perhaps run some additional tests.
Thanks for the suggestions, but I think I got it now.
Oh really? What is it then?
It's hemochromatosis. I can't believe I missed it. Excuse me, Johnson. I have to go update his treatment plan.
Wait, you're just gonna leave me hanging like that? No goodbye?
Sorry. Duty calls. Catch you later. I have a new theory. Forget epispadias. This patient is patient 0 in a super spreading event.
What? That's not even a real diagnosis, Hawks. And where are your gloves and mask?
This is highly unprofessional. We can't just go changing diagnoses on a whim.
I have to agree with Kelly. Hawks.
We have protocols to follow for a reason.
You'll see I'm right about this. Our patient is the key to preventing a major outbreak. Thanks, Tracy. I'm glad we finally got to the bottom of it.
I have to admit, you were right about the diagnosis.
Exactly. If you had just listened to me from the start, we wouldn't have wasted so much time.
But let's not forget that your wrong diagnosis could have cost the patient their life.
My wrong diagnosis. You were the one insisting on the other treatment.
I was following protocol, Hawks. You should have trusted my expertise.
Protocol doesn't replace common sense, Tracy. We could have avoided all this if you had just trusted me.